Hi, and welcome to BFRB Awareness Week. My name is Tammy Fletcher. I'm a licensed marriage and family therapist in California, and today we're launching our treatment options video series. We'll be looking at the various ways that people seek resources, support, and treatment for body-focused repetitive behaviors like trichotillomania or dermatillomania. Let me begin by saying at the very start here that there are a variety of ways that a person with a BFRB can find support. There are support groups, coaches, books, websites, physicians, and therapists out there who have experience and training in working with BFRBs. And I hope as time goes by and we raise awareness about body-focused repetitive behaviors, that there will be more and more peers and professionals who are able to offer support and treatment. Quite often now, at least for professionals in the field, is that the problem we run into is that not enough people understand BFRBs and how to best treat them. It's not at all unusual for a client to tell me that, yes, they've seen a doctor and the doctor told them to just stop picking or pulling, gave them an antidepressant, and sent them on their way. In the BFRB community, we work every day to try to offer education and to change this. But part of our job is also to educate and empower people who have BFRBs as to how they can be knowledgeable consumers and find the support that they need. Now, I'm a licensed therapist, and that's what I know best, so that's what this particular video is going to be talking about. So let's assume we're talking about therapists who have at least a working knowledge of body-focused repetitive behaviors, or they have an open mind to learn more about them. Ideally, if you are working with a therapist, they have actual training and experience in working with people with body-focused repetitive behaviors, but that's not always possible. For the sake of this video, how can a qualified therapist work with you? And how may a therapist's approach to treatment differ from others who also offer BFRB support? It's important to separate out, just for the moment, the concept of body-focused repetitive behavior versus things like anxiety disorders, obsessive-compulsive disorder, attention deficit and hyperactivity disorder, sensory processing sensitivity, depression, body dysmorphic disorder, trauma, substance abuse, and some of the other conditions that can go hand in hand with a BFRB, or that have symptoms that can mimic that of a BFRB. Now, a therapist is trained to assess and screen for a wide variety of diagnoses in order to develop the most effective treatment plan. Now, of course, not every person with trichotillomania or dermatillomania also has some other diagnosis, but some do, and those diagnoses have to be factored in for the treatment plan to be considered truly comprehensive and to increase the person's chances of a successful outcome. And let me give you an example. Let's say a person comes in for assistance with a skin-picking disorder. The therapist is going to want a detailed understanding of the skin-picking behavior, but they'll also do a thorough assessment and screening for other possible co-occurring disorders. So let's say this new client who does meet the criteria for dermatillomania also reports a significant number of anxiety symptoms. The therapist would screen for that, make a note of it, diagnose as appropriate, and then factor that additional diagnosis, the anxiety, in with the BFRB treatment plan. Another example, maybe a teen comes in for treatment of hair pulling, but reports that he has untreated ADHD. The therapist would make a thorough assessment and determine with the client how the ADHD may or may not affect the hair pulling, and develop a treatment plan that encompasses everything that's going on for the client. Now, in a case like this, it could also include consultations with parents, teachers, and even the client's physician if needed. Therapists sometimes can do things like advocate for a client's needs in school, for example, or write a letter verifying a diagnosis for a school counselor. Licensed therapists are also trained in making appropriate referrals. We develop an extensive professional network in order to help our clients connect with appropriate services in the community. We're also required to follow professional and ethical guidelines when it comes to confidentiality, record keeping, and treatment. Psychotherapists also tend to have training in psychopharmacology. We do not prescribe medications, but we have an understanding of commonly used psychotropic medications, their side effects, and we can tend to recognize when a medication may be contributing to the person's picking or pulling behavior. In those cases, we refer back to the medical team who prescribed the medication, and we work in collaboration with them when needed. Finally, psychotherapists work with relationships. How is the BFRB affecting the whole family, or the marriage, or a parent-child relationship? BFRBs impact everyone involved, and quite often significant others and family members may become involved in the total treatment plan if the therapist and the client feel that that might be helpful. BFRBs can also have an impact on the person's workplace or how they feel in social situations. Each type of professional who works with BFRBs brings a unique skill set to the table. Coaches, for example, are known for being great at setting goals and helping clients meet them. Medical doctors can help a person to uncover and deal with any type of physical issues that might be contributing to picking or pulling. Psychologists may be able to offer comprehensive testing to diagnose contributing factors like ADHD. So how do you choose the best practitioner for you? My suggestion is always to do some homework in the BFRB community, and I'll put some links below in the down bar to help you get started. I think the most important factor is locating a clinician who has training and experience in working with body-focused repetitive behaviors. Unfortunately, there are still some widely held misconceptions about BFRBs, such as confusing them with self-harm behaviors like cutting, or assuming that everyone who has a BFRB also has obsessive-compulsive disorder. Body-focused repetitive behaviors are far more complex than that. So the more your chosen practitioner understands that, the better. Once you've narrowed your search down to a few names, prepare 3 or 4 basic questions. Once you've narrowed your search down to a few names, prepare 3 or 4 basic questions about what you're looking for, and then contact each person to see if they offer some type of a free consultation to address your questions. Now, does the person get back to you promptly? Do they have any type of formal education, licensure, or certification, as well as any experience? Do they discuss a realistic view of treatment, or do they offer you an immediate miracle cure? Finally, how do you feel after talking to them? Did they listen to you respectfully and answer your questions to their best ability? All of the above will help you find a good fit in a BFRB treatment option. Thanks so much for watching today, and I welcome your comments below. Let us know what works and what doesn't work when seeking treatment for BFRBs. And stay tuned, this series on treatment options will cover everything from medical support to counseling to peer support groups.